Thank you very much, Professor Martin Röcken, for joining us today for the JDA Leadership Dialogue. The JDA has started this series to provide us a chance to talk with the leaders around the world. Professor Martin Röcken is the current president of EADV, and I have been looking forward to this occasion for a long time.
Thank you too. The origin of the EADV was by some clinicians and very few clinician scientists from academics, and they wanted to establish a European-wide training, a little bit thinking like the brother as the AAD, though the main focus is the training in dermatology. But what is special? So in the beginning around of 2000, then EADV was mainly chaired by important clinician scientists from throughout Europe, all also experienced in translational dermatology. And then they turned it into a more academic type of clinical training. The special aspect of the European Academy of Dermatology and Venereology is that even though each of the countries are relatively good and strong in dermatology, we realize that some parts of dermatology are better covered in France. So we have different experiences. And what is a beauty, if we go to the IID, so the International Investigative Dermatology, we learn that in the different areas of the world, we have different focuses and enrich each other through these congresses. And it's the EADV Congress that has been changed about 8 years ago, now 10 years ago, to be a more structured, different from the EADV, more structured, where we have tracks or symposia for one day for atopic dermatitis, for psoriasis, for infectious disease, and so on, STI, cancer, and where then we unify the different experiences from Europe in one symposium over one day and exchange our experience in surgery, in, for example, melanoma surgery, immunotherapy, side effects, targeted therapies. Our going is to include again more the practitioners because of, as you mentioned before, dermatology is almost changed dramatically, that you cannot recognize what has been 20 years ago, that we have also to take the practitioners who do not have the big insight into biology and make them understanding, not just selling the drugs that they got taught by the industry, but try to make them understand why and for what. So I think this is a major goal of the EADV. So the training in excellence, the training throughout Europe, learning from the neighbors and translating into daily practice. This is one part. The second part is that we also started to give training to young colleagues. We have a leadership training with soft skill training, but we have also, when I was president of the ESDR, the EADV and the ESDR had very major problems to communicate, but we were quite successful now in unifying this. So we are now considering no longer as enemies, but as brother and sister from different sides. And we now make common courses, common classes to our young fellows. We unify now also with patients to give a kind of advocacy. We do not see the severe cancer diseases, the severe autoimmune diseases, and make the general public aware that dermatology is like cardiology. I think we have to show to the public the impact not on burden, but the impact on really disease. That's a real disease where people are dying from and get mutilation and not only suffering from. I think that's the message we have to bring over. This is an important question. There was long time a little bit also see the kind of conflict. But now the national societies also understand that we need a kind of more broad international or inter-European education. So we have still this net, because there are many Italians who speak only Italian, many Germans who only speak German and on, but it's considered as the mother organization closely collaborating with the national societies. So it was a long time, you're correct, a kind of conflict, but it's nowadays, we really work on it to get closer and closer and joining more. Without the ESDR, or those who have been trained in the ESDR, the EADV wouldn't be what it is. It is the academic. We need the daily clinics. I was trained in a department of clinical dermatology. My trainers were excellent dermatologists, but only once I had done academics, then I learned that you have to be an excellent clinician. But if you're then no academics, you're better than somebody who is not trained in academics, because if they are not trained to understand the diseases and the treatments. I think there are two major challenges. Is really to make the best Congress, not to be for a selfish reason, just really to bring the quality and to really not only translate the academics into practice, but also to inflame the practitioners that they want to understand and that they learn, because I think this will help our patients. But I think there is another big problem that if you read Nature, Science, most articles now are on environment. If we calculate our congresses, if you make a rough calculation, you can calculate that the worldwide congresses produce as much CO2 as 1 to 10% of the world population would be allowed to produce in 1 year. These are data that we got from the big organizations, and we now from this year on want to work strongly. We are all living on one planet. And the third point is that we are working on concepts how to compensate the CO2 output. Big organizations like international recognized organization, but this is still very difficult to find the right way and the right measurement, as we know worldwide. But as everybody in the world, if the calculations come from science, come from PNS, come from nature, if the sea level will rise up to 50 meters, all harbor cities in the world will disappear worldwide. So I think it's a worldwide interest. We bring always these rare examples of these pure people from the islands, but many harbor cities, almost all harbor cities, if the sea level rises 10 to 20 meters, nobody knows it, but the calculation is even within the next 50 years, this may happen. We have a responsibility.
So it's really amazing that the EADV also thinking about CO2 output and also try to reduce the number of the people who actually travel. Actually, at the board meeting of JDA, we never discussed about the CO2 output. So that is very, very impressive. Yeah, so I want to now a little bit talk about the possible collaboration between EADV and JDA.
There are two things that we could think of. If we now forget for a moment sustainability, one, perhaps also to exchange in the main lectures, to get Europeans to Japan or Japanese to Europe to the plenary lectures, I think would be first a good goal. And then could think also of having exchange programs between trainees. Though the question is whether it's possible to make this a kind of virtual or whether it's also good. I think 2-3 years ago, I would have only said to make exchange programs directly, but in person. But we should think how we could organize common training programs.
Okay, so I think the exchange plenary lecture, this is kind of very easy to implement. We have a plenary lecture for the Dohi Memorial Lecture or Minami Award, or there is some plenary session. And also each year we have some plenary symposium. For us, it's very easy to put some plenary EADV guest lectureship or something. That is very easy. And also JDA have at least one English session throughout the day. It used to be some part is only English, but most other educational part is only in Japanese, because mission of JDA is education, as you said. So we provide many educational lectures which are given in Japanese. But at least one session each day, there is an English speaking session. During the COVID, that was difficult, but now we will put it back to the original style, have the English session throughout the day. This is also good for the participant from the Asian countries. I really want to boost up international exchange, but COVID, made this annual meeting to virtual.
It's very difficult, yes.
Trouble. Nobody from foreign countries, unfortunately. But after 3 years, we really want to put this back to normal. So I think the international platform is very, very important for JDA. And if EADV provides some core program for this event, that would be wonderful. And also EADV, the annual meeting of EADV, if you have some session of JDA representative or some JDA related to Asian representative may be good. Not only JDA, but JDA can take a leadership, but not only JDA member, but all the Asian members. But I think as you said, that the lecture level needs to be sufficient level for EADV audience. The program and speakers and topic has to be attractive for general EADV audience. Otherwise, people may not come.
But you have to get the right topics that are clinically relevant for them.
Yes. That is very important. So that would be wonderful that the EADV provide us a chance. Okay, thank you very much for your time, and we really had a wonderful leadership dialogue with Professor Martin Röcken. And so any final words to the audience from you?
Oh, dear Professor Masayuki, thank you so much. It was a real pleasure. It's also, even though we are now several thousand kilometers one from each other away, it's a great pleasure to see you in person and to meet you again. I have only my highest esteem for Japan, and I thank you so much for having opened this interaction between your society and the EADV.
Thank you very much again.